for Investing in Entrepreneurial Diversity for California's Safety Net Request for Proposals. My name is Ella Schwartz, and I'm a program officer with the California Healthcare Foundation Innovation Fund, and I'm joined today by my colleague, Charles Reeder.
Hi there, good morning. Charles Reeder. I'm the Chief Talent Officer at CHCF, and I look after all things HR and diversity, equity, and inclusion.
All right. Today's agenda includes an overview of the California Healthcare Foundation and Innovation Fund. Then we will share our organizational strategy on diversity, equity, and inclusion. We received a number of questions about the request for proposals, and we've prepared a selection of questions and answers for you today. And finally, we're going to share a peer networking opportunity at the end of the call. Just a couple housekeeping items. As you can see, your lines are muted and the chat function has been disabled. If you have additional questions or follow-up questions, feel free to send them via the Q&A on the platform. However, we may not be able to respond to them during the call, but we will post the questions and answers to our website after the call. The call is being recorded, and we will post the video, the slide deck, and you can also find all the questions and answers already posted on the RFP webpage. And just so you know, the Q&A are at the bottom of the webpage. All right. The California Healthcare Foundation is a philanthropic nonprofit endowment that is focused on improving access to high quality healthcare for underserved communities in California, specifically the Medi-Cal population, which is what California calls its Medicaid program. The foundation is focused on specific strategic priorities that we group into 3 categories. First, the high value care team is focused on improving healthcare for complex patient populations, such as maternal health, end of life care, treatment for substance use disorders, and most recently, interventions for people experiencing homelessness. The access team is focused on improving access to both primary and specialty care through interventions such as telemedicine, electronic consults, behavioral health integration into primary care, and alternative workforce such as community health workers. The Innovation Fund works alongside the high value and access teams to understand the pain points in the healthcare system and source health technology that can provide solutions. The Innovation Fund invests in mission-aligned, venture-backed health technology companies that we believe have the ability to scale and spread in the Medicaid market. The fund makes a direct financial investment in the company and offers grants to our safety net partners on the ground or in the community to support adoption or perform an evaluation in order to understand the value of the impact. The fund was founded in 2011, and we are thinking about what the next 10 years will look like and how we can support health equity by investing in diverse entrepreneurs.
So just a little bit of flavor about our journey around health equity and diversity, equity, and inclusion. What this slide is trying to depict is a little bit of that journey, and it's not linear. So, you know, if I start from 2017 in lockstep with our board, we actually adopted a strategic framework that looked at health equity, specifically, again, within the Medi-Cal population. And so as we started to think about our work through that lens, it was important for us to, of course, start with ourselves and look internally. And so this is where you see this second step of really encouraging and supporting our colleagues at the foundation to dig deeper within themselves and uncover and appreciate each of our lived experiences and how they lend themselves to our work in support of our mission. And that kind of brings us to where we're at today, right? So the data is there that shows that, you know, our portfolio companies lack diverse leadership, both from people of color and women. And it's important for us as we think about health equity through our work, and we think about what's important to us as individuals doing this work, and realizing the health equity gaps that is currently kind of present in the healthcare delivery system, that we continue to make a push on this journey.
We appreciate that each of you on the call today are interested in and excited about this request for proposal. And we've gathered a selection of the questions we received and our answers to share with you during the call. A full list of the question and answers, again, can be found on the RFP webpage. So we received a couple questions about the current thesis of our fund and how we have tried to increase the diversity of entrepreneurs in our fund previously. The Innovation Fund has not had an explicit strategy focused on increasing entrepreneurial diversity in the past. As Charles said, broadly within our foundation, CHCF has employed a health equity lens in its grant making and often prioritizes interventions and opportunities to reduce health disparities. This RFP and project will be our first time to develop strategic priorities to bolster diversity within the Innovation Fund. The fund currently invests in venture-backed companies, typically Series A through C, that have the capacity to scale and spread across California. And unfortunately, as many of you know, persons of color and female entrepreneurs are underrepresented in later stage companies. We received a question about the availability of data about the companies that we have vetted previously, but did not invest in. CHCF does not have a current method to systematically track quantitative data on the prospective companies. To source companies, the fund works closely with other investment firms that are strategically aligned and also invest in companies that target Medicaid or other populations that our foundation is focused on. As a part of this project, we are open to establishing a method of tracking relevant data points. The next selected question asked about our current and future investment thesis. CHCF invests in companies that actively serve Medicaid populations, and as a strategic social impact investor, the fund specializes in the Medi-Cal system, including knowledge of Medi-Cal's complex business and policy structures. CHCF specializes in health technology that is innovative and will develop new models of care for the complex patient population in California. And although we currently invest in Series A through C companies, we are open to exploring a pre-seed and seed stage investment vehicle or other mechanisms to source a greater number of diverse entrepreneurs. We received a handful of questions related to the scope of recommendations stemming from the project. The focus of this effort is on racial and ethnic diversity and potentially female entrepreneurs. Although we are thinking about diversity of founders, we are open to strategies to diversify the broader leadership teams within the health tech companies and investment space. Although the fund currently invests in Series A through C companies, we're also exploring alternate investment vehicles if it allows us to support a greater number of diverse entrepreneurs. Lastly, we received a couple questions related to the CHCF approval process and the budget for the recommendations that stem from this project. Every project at CHCF goes through a collaborative and iterative approval process, including peer and board review. It may take multiple months to finalize a new initiative, depending on the size and complexity of the project. In our current portfolio and investment structure, CHCF aims to invest in 2 to 3 companies per year, with approximately $1 million invested for each of those 2 to 3 companies. We anticipate the recommendations stemming from this project would be additional and likely not to exceed $1 to $2 million per year, although the funding could be maximized if we partner with other investment firms. So all of the questions we received and our answers can be found on the RFP webpage at the bottom. I haven't seen any additional questions come in during the webinar. Oh, sorry, scrolled too fast. So we received this idea from one of the fellow applicants that's on the call today. This represents an exciting opportunity to possibly network with the community of consultants and strategists and thought leaders who are interested in the RFP. And so if you are interested in meeting the others who joined the call today, please let us know. We can gather your information and send it out just to those that respond that they're interested in the peer networking opportunity. I see one question about flexibility on the project timeline and deliverables. Yes, we posted this question and answer to the RFP page already. The original RFP has a project timeline between July and end of August. Within your proposal, you can suggest something more flexible within 2 to 4 months. Okay, so I'm getting more questions that are also have been answered and are posted on the RFP page. We are asking that the proposals be 5 pages or less. And a question about how many people are on the call, which I am not sure how to answer. Oh, I can see.
Looks like there's about 44 people joining us today.
45 people, including some CHCF colleagues. Any other questions that somebody wants to send through the Q&A for either Charles or me? Okay, seeing no more questions, we can, oh, here's another question. Charles, there's a question here for you about when we started the internal DEI work.
Okay, I think it's a continuation. So the question is, when we did the internal DEI work, was everyone engaged all the way up to the board level? Yes, I would say, when you're doing diversity, equity, inclusion work, it really has to start from the top. And so, our CEO, Dr. Sandra Hernandez, is really supportive of this work, and therefore the board is also engaged and supportive. And, being a mission-aligned organization, most of our colleagues come to work every day because we want to improve the healthcare delivery system for all Californians, specifically those that are served by Medi-Cal. And so, I would say our colleagues recognize that we have a lot of learning to do. We're not perfect. It's a marathon. It's not a sprint, right? And so it's a long way to say, yes, everyone was fully engaged in the process.
Thank you, Charles. There is a question here about presenting findings in person. The foundation is currently remote work, and we're following the local and state and federal guidelines around social distancing. So depending on where we are at as a Bay Area and nation in August, September, when the project is actively going, will determine whether or not there's an opportunity to meet in person. We have a question around our preference for contracting and awarding the contract to a team or single consultant. We do want to award to one entity. It's okay if the entity has multiple people working on the project, but the idea is to award the project to one person or a team of people that are aligned. So please submit your proposals in that way. There's a question around our process for selecting the grantee once proposals are submitted, and if we have additional questions, what that process is like. So if we have additional questions about proposals, or there's a few proposals that we are considering, we will outreach and ask for time to schedule a follow-up call or Zoom video. There is a question around I don't know if you guys on the call can see the questions that come in, but there's a question around the types of organizations that can apply for the call. There's also this is not the first time that question has been asked. We have posted answers that are similar to the RFP webpage as well. That's a really great question. I think the proposal has some criteria for the subject matter expertise that we're looking for this project. We are looking for a person who understands both the investing side and the venture capital landscape, as well as the healthcare innovation, technology, and safety net marketplace. So please consider that as you put together your proposals. There is a question around what the proposal criteria, like the elements for the proposal are between what was posted in the RFP and then what the foundation has listed on the grant proposal page. Please try to follow both. If there is a difference, what we've been told is that it might be with the page limit. We've asked for proposals to be 5 pages or fewer. So please follow both what the RFP is asking for as well as what the grant requests. I think it asks for the grant at the foundation level, asks for some additional information like W-9 and things like that. So please try to meet the proposal packets built off of both what we've asked for in the proposal and what the CHCF grant page requires. We will post this slide deck and as well the recording from today on the RFP webpage. There's a question around whether researchers who own small businesses in maternal health equity are eligible to answer. If you meet the criteria for the proposal and you have the subject matter expertise and you want to submit a proposal that helps us think about how to build the diversity in our investment strategy, please, we encourage you to submit your application. There is, somebody asks if they're eligible to apply being based in New York. I think there are multiple people on the call that are probably outside of California. Typically, the foundation works with local grantees, but we are able to consider grantees from out of state. There's a question about formatting. This is also on the RFP webpage. We don't give you the formatting requirements. Please just do submit a proposal that you feel best represents your vision. Other questions about the proposal style and format, the answers can be found on the webpage. There's a question about Astrid,
I think that was a carry on from the question around our DEI strategy. And so the question is, have we done any related work with our companies that we invest in, what I would call our partners? And the answer is not yet, but coming soon, right? So again, as we think about ourselves first internally, kind of the next step in that strategy is to try to share some of our learnings with our partner organizations, both within the fund and more broadly at CHCF. So thank you for that question.
Thank you. There's a question here about whether a for-profit entity can apply for the project. Yes, for-profits can apply. For-profits, consultants, strategists, nonprofits, we will accept proposals from different types of entities. There's a question about our ideal outcome for the RFP and for CHCF, which I think is a great but complex question. Ultimately, we are looking for opportunities to improve diversity in the health tech space so that we believe there are interventions and solutions and innovations that are more closely aligned and represent the diversity of the population in California. As the RFP describes, our portfolio has, over the last 10 years, invested in approximately 20 companies, of which one was founded by a person of color and one was founded by a woman. And so if our ultimate goal is to improve the diversity of the portfolio companies that we invest in, it might be that we achieve that through developing an alternate investment vehicle, or it might be that we change or modify the pipeline or sourcing process for our current fund. We are really open to different strategies to achieve the ultimate goal of being more supportive of diversity of the entrepreneurs in healthcare technology. There's a question around organizations that are also working in diverse investment, prioritize diversity in their investing, which is a great question. We can follow up with some resources or references to companies that we often work with. There's a lot of investors that are also prioritizing how to support equity and diversity in their investment space, and we can share some of those on our website after the call. There's a question here around the RFP, the sections that we ask the applicants to address in the RFP, and how that's different from the CHCF proposal. I think we can follow up with that in writing after the call, because I want to make sure that I am looking at the same pieces that the person is asking about. There's a question here around how we weigh diversity, equity experience versus understanding of venture and the social safety net market. And I think, as our criteria states, the ideal applicant will understand both pieces of this. So hopefully we will receive applications that allow us to work with somebody who has understanding or experience working with both of these segments of the subject matter. Charles, I don't know if you have anything to add to that.
No, I think that was great. Thank you.
Okay, other questions? So there's a question about how to submit a proposal. There is an email address for our grants coordinator in the RFP. Her name is April, and you should email her the proposal packet. There is some instructions at the bottom of the RFP for the format, and that gives her email address, and then a reminder to submit, I think by 3 p.m. the day of the deadline. Very thorough questions. Thank you to everybody who joined the call. There's another great question here around the networking opportunity from somebody who feels that they could contribute on somebody else's proposal. So please, if you're interested in networking with others on this call, either for other work that you do in the field or because you're looking to team up to submit your application for this specific RFP, please feel free to email the Innovation Fund at chcf.org, and we will compile the people that are interested in networking and send it out. Yeah, so there's a question here around the recommendations that stem from the project, if the decision was made to create a new investment vehicle, like a seed fund or a pre-seed fund, how much money would each company receive? And that is yet to be determined. That is part of what we hope the strategist in this work will help us figure out. How many companies can we impact, and how much money is needed to make an impact is certainly a question of ours as well. And we're looking forward to exploring that idea and others through this project. Okay, I think we've gone 30 seconds without a new question. I'll wait 15 more seconds. You can also send your questions to the Innovation Fund at chcf.org, and we will provide answers and refresh the question and answer sheet that's currently on the RFP page to include anything that came in during this call or comes in after this call if you think of anything else that you want to know about. All right. Seeing no more questions, we will end our webinar early. Thank you so much for joining us and sharing your enthusiasm and passion for this work. Charles and I and everybody at the foundation and the fund are very grateful for your energy and attention and interest in this work.
Thank you. Yeah, stay safe out there.